For the first portion of this video, we're going to be going over the different regional terms of the body. First off, hallux, big toe. Second, axillary, the armpit. Third, buccal, the cheek. Fourth, we have pollux, or the thumb. Next, we have patellar, or the front of the knee. Then we have oral, or around the mouth. After that is mental, or the chin. After that, we have the brachial, which is the upper arm. Next is antebrachial, which is the lower arm. After that, we have crural, which is the portion of the leg. After that, we have umbilical, which is around the navel. After that, we have femoral, or the thigh. After femoral, we have calcaneal, or the heel. After calcaneal, we have sural, which is the calf. After that, we have popliteal, which is the back of the knee. After that, we have the olecranon, which is the back of the elbow. After that, we have the acromial, which is the point of the shoulder. Lastly, we have occipital, or the back of the head. In this portion of the video, we will be going over different directional terms. First, the head is superior to the sternum. Head is superior or higher up than the sternum. Next, the olecranon, or the back of the elbow, is distal to the acromion, the point of the shoulder. It is distal or further away from the point of attachment. Next, the axilla, or armpit, is proximal to the brachium. The axilla is proximal or closer to the point of attachment than the brachium. Next, the nose is medial to the eyes. So the nose is medial or closer to the center line than the eyes. Next, the elbow is proximal to the carpus. So the elbow is proximal or closer to the point of attachment than the carpus or wrist. Elbow proximal to the wrist. Next, the sternum is anterior to the vertebral column. Again, the sternum is anterior or farther forward than the vertebral column. Sternum anterior to the vertebral column. Next, the umbilicus is inferior to the sternum. So the umbilicus is inferior or lower than the sternum. Next, the patella, or the knee, is proximal or closer to the point of attachment than the tarsus, or the ankle. The knee is proximal to the ankle. The ears are lateral or farther away from the midline than the nose. For the last portion of this video, we're going to be going over the 9 abdominal pelvic regions and a couple of the organs associated with them. First off is the right hypochondriac region, which houses part of the liver and the right kidney. Next to that is the epigastric region, which has the stomach and another portion of the liver. Next to that is the left hypochondriac region, which has part of the small intestines and the left kidney. Moving down, we move into the right lumbar section, which has the liver and the small intestines. In the center, we have the umbilical region, which has part of the stomach and the pancreas. On the left side, we have the left lumbar section, which has part of the descending colon and another section of the small intestines. Moving down, we have the right inguinal, which has the appendix and another portion of the small intestines. Moving to the bottom center, we have the hypogastric region, which has the urinary bladder and the sigmoid colon. Moving to the left, and finally we have the left inguinal, which has part of the descending colon and part of the sigmoid colon.